Hello everyone! Today I'm gonna talk about COVID and hair loss. After 2 years of pandemics, COVID is still here and we do see a lot of cases of hair loss. But for me, it's not only a story of many patients I see in clinic with hair loss after COVID, but it's also my personal story because it is something I'm fighting with right now. I didn't have COVID for 2 years until this July, when I had a very mild infection that lasted just 1 week. However, 2 months after the infection, I did see lots of hair shedding after brushing or after showers. This is how much hair I would have right after one brush. And that was pretty devastating because I already have a condition that is called female pattern loss or androgenetic alopecia, and I do take oral Minoxidil for many months for this condition. So what do we know about hair loss after COVID? We did accumulate quite a lot of data in these 2 years. First of all, we know that a lot of patients actually lose hair after COVID. According to different literature data, it's up to 25 or even 40% of patients. More commonly, it's women who have more severe hair loss. But in general, the severity of hair loss is not always correlates with the severity of COVID. Of course, if COVID happens with fevers, with complications, we do expect more severe hair loss, but sometimes patients lose a lot of hair even after mild infection, as happened, for example, in my case. We also know that COVID somehow disproportionately affects patients with androgenetic alopecia, and those patients may have more severe COVID infection. We call this phenomenon Gabrin sign. Frank Gabrin was the first emergency room physician who died after a severe COVID infection, and he did have a severe prominent androgenetic alopecia. Shedding usually happens in two forms. The most common form of shedding that happens after COVID is called telogen effluvium, and it does start after 2 or 3 months after COVID infection. The less common form of shedding is anagen effluvium, when shedding starts right after the infection. Unfortunately, we do not have any way to stop or prevent this shedding, and we don't know what is the best treatment for it right now. Usually, I recommend my patients to avoid stress, to normalize nutrition, to have an adequate protein and vitamin intake. If they desire some treatments for stimulating hair growth, I can recommend PRP injections and sometimes topical or injectable steroids. There is a questionable data about Minoxidil in hair loss after COVID, because yes, on one hand it can stimulate hair growth. However, at the beginning, Minoxidil may cause even more hair shedding, which can be even more dramatic for some patients. And we also don't know how long Minoxidil should be used after COVID. However, I would highly recommend patients to see a professional if COVID hair loss does not stop in 4 to 5 months as we expect it to do. Why? Because in small proportion of patients, our hair loss after COVID can actually unmask this androgenetic or pattern alopecia, and then a patient may need a lifelong treatment. Also, we know that small proportions of patients may have a different disease, such as alopecia areata, that was described in couple patients during COVID, and we don't know if it was stimulated by COVID or those patients already had a mild cases that were not diagnosed, or maybe they were predisposed to have alopecia areata. There are also a couple cases of alopecia areata happening after vaccination that also should be taken into consideration. So, of course, if hair loss is prolonged, if it doesn't improve, it's imperative to see someone who can establish a diagnosis and to evaluate why hair loss is happening. If you have some questions, please comment below. I would be happy to answer your questions, and I will keep you posted about my progress of hair loss. It's 1 month already, it's getting a little bit better, and I hope for the best.